Good morning, ladies and gents. Welcome to this channel. I have got Dr. Vijay Langer, who is a cosmetic and plastic surgeon coming all the way from India. He just landed yesterday, so thank you for gracing us today. And he is from Fortis Healthcare. And it is a group of hospitals. It's actually the second largest in India, right?
Right.
But you focus specifically on Fortis LaFemme,
Yes.
which is the one that focuses on women, right?
All women's hospital.
Right, exactly. So maybe you could tell us a little bit about that and about you and how you came here, how you got here.
Right. Thanks. So Fortis Healthcare has, as you said, the second largest chain of hospitals in the country in India. It has 54 centers, out of which 12 are. But a lot of it focuses in the northern part of India. That's where I come from. New Delhi has 12 such hospitals.
Okay.
Specifically with LaFemme, I'm working with LaFemme for the past 6 to 8 months now.
Okay.
And it's an all women's hospital, which takes care of all the needs and privacy and world class care for women.
Yeah.
We get patients from all over the country and indeed from various parts of the world. It's really satisfying because we've got multiple specialties and super specialties in the hospital, and we take good holistic care of our women there.
Right. And earlier,
Sorry.
Okay.
I was with the Indian Army.
Yes.
For 28, I would like to believe, golden years.
Wow.
And 14 years of plastic surgery service in the Indian Army, and I used to take care of a lot of trauma reconstruction, cancer reconstruction, and a lot of women and children and even serving soldiers who would get burnt in their line of duty.
Okay.
And arguably we have our largest series of in the country and possibly in Asia. On early burn wound excision, where we used to go in and excise or cut out all the dead parts of burn tissues and improve survival to up to 60-70%
Okay.
burnt areas.
Okay.
We could do with a lot of conviction, a lot of hard work. It was a huge team effort, but we could do that.
Right. So actually, earlier you were telling me something very interesting regarding some of the most difficult or strenuous surgeries that you've had to do.
Yes.
Do you want to take us, just before we get into all the other stuff, but do you want to just recount what you were saying about the
Replantation.
replantation of the fingers?
So these have been a few patients who've come to us with traumatic injuries. There were some seriously macabre incidents. I remember one lady whose fingers were chopped by her husband because he thought she was having an affair.
Yeah.
So that took about 16-17 hours to stitch back, and that is not only just putting the skin right back, it's fixing the bone, tendons, both the flexors, which will flex the finger as well as straighten it, and arteries, veins and nerves.
Right.
So it's pretty
Very difficult.
Technically demanding surgery.
I can only imagine. And you know what's also very interesting? I think a lot of times when people hear plastic surgery, they automatically assume that you're there to get, I don't know, like eyebrows done or your cheekbones done or your lips. They think it takes on that route, but there's obviously a lot more to this world. You just gave a great example, and I think also, even in the world of oncology, there's an opportunity for women who have, say, for instance, had their breasts taken out to be able to get a piece of themselves back or to feel a little bit like themselves.
Absolutely, and it's, they do really great on self-esteem because
exactly.
The self-esteem is, you got the threat dangling on your neck, that of cancer. That's enough to drive anybody mad or on the defensive. And you do not replace the part of the body that is amputated, and which is so important for a lady. I think that's where we come in and we do this. Interestingly, you talked about plastic surgery being equated just as with cosmetic surgery. It's actually not so. Plastic surgery takes its origin from a Latin word called plasticos, which means to mold.
Oh,
it has nothing to do with plastic.
Right. I think it's all the TV shows that show plastic surgeons and then people getting like butt implants, and you think that's all there is to it.
So that the whole branch surgical science is divided into reconstructive and cosmetic.
Okay.
Cosmetic is a very important part, and cosmetic is a very gratifying part as well, because it is a reasonably looking person wanting to look better.
Right.
And that means the challenge is possibly in some ways much more than in reconstructive work. Because in a lot of deformed hands, you can do just that much and not beyond. You can't possibly give them 100% reconstruction,
right?
But enough to allow them to carry on with their own work. In cosmetic surgery, however, the stakes are much higher. You have to be that much better. Because the patient is always, I mean, he or she is absolutely fine. When they walk in. And they want to look better.
Exactly.
And so nothing can go wrong.
And it's those little nuances, you know, they might be upset about the tiniest thing, so you have to be even more precise. But I was actually wondering, so what are some of the main treatments that people, when they're coming to you, say for cosmetic surgery, what are some of the top treatments or the top things that you hear a lot about that more and more women are interested in?
Right. Basically, liposuction of various parts of the body. Breast augmentation as even reduction. Breast reduction is a procedure which is akin to a reconstructive procedure because the lady is lugging a lot of load on her chest. And when I trained in the US in 2009, I did my fellowship in body contouring following massive weight loss. That's another part. I'll touch upon that just in a bit. So a lot of ladies would come, carrying their breasts, so to say, on their hands like that.
Oh wow!
So this causes a lot of shoulder pain, back pain, and a lot of infection on the undersurface of the breast and so on. So these are always win-win situations. The patients are always, the only thing they say is, why did I not get this done before? So liposuction, breast surgery, and then abdominoplasty or tummy tuck. These are the common ones. And we are also getting cosmetic gynecology in the form of genital rejuvenation and various other things. The other subset is the massive weight loss. In our part of the world also, we are increasing the number of obese patients who are undergoing what is called as a bariatric surgery. So in that they reduce the size of the stomach from a bag to a tube, and also a bypass surgery. But I won't go into those details. That's not my specialty. But more importantly, that these patients lose a lot of kilos, many pounds, 50, 70, 80, 100 pounds.
Oh wow!
And then...
And do they keep them off, or I guess it's on them too?
No, but then the weight, the skin and the fat envelope starts sagging.
Oh.
And that's when they have to undergo...
Oh, I see what you mean.
The body contouring. That's when that's what I've trained in the US. So that's my other specialty.
I'm also curious to know if Fortis LaFemme offers, say, counseling or some kind of psychological treatment as well, because for a lot of the people that you're talking about coming in to see you, you know, whether it's they have burns or they had, you know, they wanted a breast reduction, it's a big decision to make, to alter your body, whether it's, you know, whichever way you look at it. So is there some kind of counseling offered as well for a lot of the women who come in?
All our patients, especially such patients with such makeovers and body deformations. They and large, long surgical procedures. They definitely have there. We have a counseling section, and we do our psychotherapy. A part of it is done by me because that's also very important, because the patient has to feel very confident in the plastic surgeon.
Oh, good. Lovely. I have to ask this question because a lot of times it's assumed that it's women who want to have things done, you know, something changed, something tweaked. But do you have men coming in for cosmetic surgery?
Oh, absolutely. For hair transplant,
Okay.
for gynecomastia, which is so important when it comes to adolescents, males who have breasts somewhat similar to those like ladies,
Okay.
women's breasts. They want that reduced, and liposuction and even penile lengthening and augmentation. So
Wow, okay.
the world's opened up completely.
See?
The
So,
facial rejuvenation also. I mean,
oh,
we get
yeah.
men. I mean, we get more women, of course.
Yeah.
But we do get men for facial rejuvenation, facelifts and Botox fillers and so on. So
Look, I'm so glad I asked that because I bet a lot of women were like, aha, yeah. And some men would probably be in the comments or watching and thinking, oh, I don't know how to ask this, but what if I wanted this done? Look, LaFemme focuses on women, right? But Fortis, I'm sure, can take on as many of you guys and as many of your needs as you may have. And you've heard him mention all the things that happen. So don't say I didn't hook you up, guys, okay? If you want, contact him, okay? Thank you so much, Dr. Langer, and thank you to Fortis as well for continuously providing good healthcare solutions. We will leave all the information in the description box, so if you would like to get in touch with Daktari, which is how we say doctor in Swahili, Daktari.
Okay.
If you'd like to get in touch with Daktari, you can reach him in the contact details that we'll put in the description box. Thank you for watching, and thank you again.
Thank you.
I hope you enjoy Kenya.
Asante.
Oh,
What do you-
karibu. Yeah, exactly. Perfect. See you guys very soon. Bye.
Thank you very much. Bye-bye.